I'm Dr. Gayana Amiyangoda, lecturer in pharmacology at the Faculty of Medicine, University of Peradeniya, and a consultant endocrinologist with special interest in lipid management. In the previous video, we talked about your cholesterol and tried to understand the results of your lipid profile or the cholesterol report. And in this video, we'll see if your cholesterol was found to be high, what can you do about it? So if your cholesterol was found to be high, can you reduce your cholesterol level by yourself? Yes, you can. How? Except in certain genetic conditions and in certain medical conditions, you can reduce your cholesterol level by eating healthily, exercise, controlling your weight and body mass index, limiting your alcohol intake, and controlling blood sugar most of the time. We'll talk about these one by one. How to eat healthily. If you have a look at these green bars, the food categories mentioned in these green bars are helpful to reduce your LDL cholesterol, namely vegetables, fruits, pulses, whole grains, also legumes and oily fish. And food categories mentioned in red bars like food in high amount of saturated fats like red meat, butter, and also high glycemic index food, they can increase your LDL level. So if you can incorporate more food categories or more amount of food in green bars and reduce the number of times that you eat the food categories in red bars, you can decrease your LDL cholesterol level. And we know our Sri Lankan diet is mainly based on rice. So if you take a plate of rice, if you can incorporate more vegetables and green leaves and more lean meat than carbohydrate or starchy component, it will help to reduce your LDL cholesterol. And the next way is by controlling your weight or controlling your body mass index. Body mass index stands for what is your weight for your height. So if your body mass index goes above 23, there's a high risk of developing high LDL cholesterol level. So if you can control your weight and then control your BMI, you can reduce your LDL cholesterol as well as can improve your HDL cholesterol and reduce the risk of getting heart attack or a stroke. The next way is by improving physical activity. Having moderate intensity or high intensity exercises such as jogging, running, cycling, and gym activities, and also basic sports, if you can involve in these type of exercises or physical activities at least 2.5 hours per week, there's a high chance that you can reduce your LDL cholesterol and increase your HDL cholesterol, and it also helps to maintain your body weight. And as we discussed, having higher amount of alcohol consumption will increase the risk of developing high LDL cholesterol as well as triglycerides. So it is recommended to cut down the alcohol consumption if your LDL cholesterol as well as triglyceride levels are high. So all these times we talked about lowering your cholesterol level. Why? We want to get down the risk of developing a heart attack or a stroke. So apart from the cholesterol, there are other risk factors that will increase the risk of heart attack or a stroke, like high blood sugar, high blood pressure, and smoking. So at the same time we are looking at reducing the LDL cholesterol, it is important to consider the other risk factors to control or reduce the risk of developing a heart attack or a stroke. So the ways that we discuss are the ways that you can try to reduce your LDL cholesterol by yourself. But if your cholesterol level goes up above 160 milligrams per deciliter, or even at a lower level when you are having other underlying medical conditions, you might need to be started on medications which are helpful to reduce your LDL cholesterol. So we'll talk about the medications that are useful to reduce your LDL cholesterol in another video. Thank you.